Have you ever wondered why almost every movie shows women giving birth flat on their backs? Here's the truth, that position isn't usually the easiest, safest, or most effective way to push a baby out. And even in a hospital, you don't have to do it that way. Hi, I'm Rachel Moises from the Mighty Mama Movement. I'm a mother of 8.
And I'm Heather, a family nurse practitioner and midwife.
In today's video, we're talking about birth positions, why the on your back position became so common, what the research says about alternatives, and how you can stay in control of your body during birth, even in a hospital setting. So to begin with, let's talk about the history of giving birth a little bit and why it is so common in the United States in this day and age to give birth on your back.
So throughout history, of course, women didn't have epidurals, right? They gave birth naturally.
Or even really hospitals until relatively recently.
Exactly. And so the most natural thing to do was to get up in the squatting position or a sitting position. So if you look at old paintings, I remember when my family went to France and we went through all of the museums, and so much of the art showed breastfeeding because of course that was a very natural formula. Wasn't like
part of life,
right? And there were birth chairs where they would typically have a woman sitting on either side of her, and the chair had kind of this cutout in the middle, because laying on your back is just not comfortable. It's just not very conducive to the woman's comfort to giving birth. Women give birth upright, hands and knees. Nobody goes, I'm going to lay down and give birth today.
Well, I mean, maybe even on your side. I know some women are like,
Right.
oh, I just felt like being on my side with my leg up or something.
Yeah. But nobody lays on their back like they do in the hospital. You just don't do that. That is a taught thing that is absolutely not instinctual.
Right.
It's not something you would just go, hey, I think I'm going to do it this way.
This feels like the best way.
Right, exactly.
It's hard to know. And like you said, you kind of have to look at history, because in this day and age, that is what our mind probably goes to, because that's what we've seen and grown up, I think, assuming is like normal.
Exactly. So in the 1600s, one of the kings of France wanted to see his wives give birth. And so he would hide behind the curtain, because men weren't allowed in birth unless there was a doctor there. Otherwise, it was just midwives and such. And so he would have them give birth on their back so that he could watch what was happening. Then forceps were invented. And of course, to use forceps, the woman has to be on her back. So as we go throughout history and birth becomes more medicalized, and then after World War I and World War II, it moved to the hospital, women were demanding to not feel childbirth. And one of the Queen of England was a big part of that. And so women wanted to give birth like her. And so they did twilight sleep, which is scopolamine and other basically just knocked you out. Well, if you're knocked out, you can't give birth upright. You're laying down. And so it really became the norm. And doctors found, well, this is much easier for me if the woman just lays down on her back, spreads her legs, and gives birth
There's
this way.
The baby right there. Yeah.
You know, where like when I help women, we use the birth stool about 40% of the time. We have about 40% in the tub. And only about 10% of our moms give birth in the bed. And that doesn't mean she's on her back. She could be on hands and knees, laying on her side, but a very small amount. And as a result, I'm sitting on the floor. I literally sit on the floor and help catch a baby on the birth stool. And doctors really don't
or
like
you're
to
having
sit
to
on floors.
Grab the baby out of the water,
right.
And all of that.
Exactly.
It's a little more adventurous.
Exactly. So a big part of it is you have to look through history and find out how it became, because I promise you, it was not women going, I think I'll give birth on my back.
Yeah. Well, and also, I mean, there's a lot of cultures today that still are a little bit more indigenous and living a bit more of a not westernized lifestyle, who still practice this, where you'll see that it has never occurred to them to give birth on their backs. They do it squatting or usually squatting or other approaches, right?
Upright positions.
Yeah, and that's even in this day and age, cultures that are less influenced by the Western that aren't westernized basically and still kind of indigenous will
Right.
do that. Okay, so why does it even matter? Like what's just give birth on your back? Is there anything unideal about
Right.
that?
Well, besides the comfort measure, when you lay on your back, the uterus kind of pushes up against your diaphragm and into your lungs, and it makes it really hard to get a good breath of air. I mean, think about it. You have a hard enough time when you're pregnant breathing.
Mm-hmm.
Laying down and having that uterus push up makes it even harder to breathe.
Mm-hmm.
So that is one of them. And getting upright, we're working with gravity. So when we're on our back, baby is actually being born up. But if we're upright or on hands and knees, baby is being born down with gravity helping us rather than going against gravity. So that's one of the good things there. And we can breathe so much easier.
Yeah. So I know this is not the most pleasant thing to say, but we're talking about birth, and birth is a little messy, but if you just think about having a bowel movement, nobody poops lying down. Right. Why would you ever do that?
Right, exactly.
Really weird to think about. But it's true that your body, obviously, the way it's made, you do that upright. And pushing a baby out of your body is a little bit of a similar situation. You've got a bigger thing that you're having to get out of your body. So it just makes sense that you would want gravity helping. Right.
The other thing is the pelvis, when you're laying in bed, it stops the sacrum from moving and opening, and the tailbone, it kind of kinks it in. Where if you are hands and knees or in a squat, sitting, any of that, the pelvis can open without any restriction of the bed. Yeah. So that is another really, really big one that is good to get upright.
And the whole point is that you want pushing to be as easy as possible. You want getting the baby out of your body to be as easy as possible. So being in a better position for your pelvis and for getting the baby in the right position and the gravity, all of those factors are very helpful in having an easier pushing phase.
Right.
So let's talk about hospitals. We've talked in some other videos that one reason a lot of women choose to give birth out of the hospital is because they tend to have more freedom and just less restrictions. It's just much easier to have the freedom of movement and different birthing positions. Like you said, as a midwife, you're used to being down on the floor and you don't think twice about it, whereas a doctor almost never does that.
Right.
But the majority of women do give birth in a hospital, and they do want to give birth in a hospital. So what options do you have if you're doing a hospital birth, but you're like, well, I want to take advantage of those benefits of not giving birth on my back?
The big thing is your care provider. So most women in the United States give birth with a doctor. About 15% give birth with a midwife of some sort. And so that means 85% of women, give or take, give birth with a doctor. And you are at the mercy of your doctor that way. Unless you start demanding change, you're at the mercy of your doctor. So I had a woman for 2 of her births. She always gave birth in the hospital. And she came to me and said, will you rent me a birth stool? And I was like, yeah, like, where are you giving birth? And she said, with so-and-so doctor in this hospital. And I thought, okay, well, I'll rent her the birth stool, but I'll be shocked if the doctor lets her give birth on this birth stool. And she did. So she came back for the next pregnancy, and she said, yeah, he let me give birth on the birth stool, and he got on the floor. And I was like, holy cow, I can't believe this doctor did that.
So she was proactive, and she's like, I'm bringing my birth stool with me to the hospital. And
she did.
Okay.
But I've known other doctors that, you know, the nurse will get mom in hands and knees and moving and walking around. But as baby begins to crown, they get the doctor in there, and the doctor's like, get her on her back. It's the only way I'm doing it. And so it's something that you have to prearrange with the doctor. Sometimes they're like, you know what, I am catching 50 babies this month. I'm not going to hurt my back. Mom can get on her back. Like, I'm not doing this. I mean, it's kind of selfish. If you don't want to hurt your back, then don't be an OB.
Yeah.
You know, because let me tell you, my back hurts a lot of times as a midwife. And we have to talk to those doctors, and I mean, I hate to say it, but quit giving them business if they're not willing to change. The other thing is that when I was a doula, I had women who wanted to give birth on hands and knees. And I had a doctor go, I don't know how to do that. And I was like, what do you mean? Like it comes out the same hole. And he goes, yeah, but everything's backwards.
Yeah.
He's like, how do I help a woman give birth? And I just thought, you went through 10 years of medical school and training and you can't think how to do left is right and right is left and like troubleshoot this dude.
Yeah.
Like come on. And so for many doctors, you're stepping out of their comfort zone, their bubble. And the really good doctors are the ones that will say, okay, I've never done it this way, but let's give it a go. Let's do it. They just need that first woman to say, this is how I want to do it. And then they have to be willing to step out of their comfort zone and just do it. I remember the doctor that I work with, he was like, Heather, your moms give birth in all these different positions. And he was like, how do you do it? And I went, I don't know, you just do it. Like, you just have to do the first one and then you just figure it out from there, And it was just interesting him going, I don't know how to do that. And I'm like, it's because you've never tried. It's not hard. So that is the big thing, is you have to look at your nurse. I had another nurse as a doula. Okay. And I said, mom wants to push on hands and knees, and then she wants to give birth on her side rather than on her back. And it was in Texas, so I'm going to do a little Texas accent here, okay? And she said, honey, I've been helping women for 20 years, and the only way I've ever seen a baby is on the back. So she's going to get on her back, and we're going to have a baby that way. And I was like, you've done this for 20 years, and you have never seen a baby born any way but on the back.
Wow.
And I was like, that's sad. That is really, really sad. But I always remember that Texas accent coming out,
So I guess, okay, my first 3 births were hospital births, and they were just like that. I did know that it's better to be more upright. And so I remember asking them I was on like a delivery table. It wasn't a bed. It was the same table where they do C-sections. And that's where I gave birth at this hospital.
Yeah.
And so they could put it kind of like upright. So I remember asking the doctor to do that, and he put it a little bit upright. I'm like, more, like until, and so then I was a little bit kind of in an incline, kind of like if you were on a weight bench, like at an incline in that position. So maybe that helped a little bit. I don't know. I had really horrible, bad pushing experiences, so maybe it didn't help at all. But I knew that it was better to be kind of upright. So I kind of tried, but okay, but my last 5 births have been at a birth center with you where I had all the flexibility I wanted. So basically you're saying if you're in a hospital beforehand, talk to your doctor and see how open and willing they are with that.
Exactly.
But I know that you also don't know who your doctor's necessarily going to be attending your birth when you do go into labor.
Right.
So how likely do you think it is, in this day and age for women to be able to say, no, really, I'm not giving birth on my back? Like, is it going to be a fight for most women? Or I just feel like, what? Don't more doctors know and understand? I'm surprised to hear this.
Most women, it is going to be a fight. I'm afraid it really is. My second baby, I didn't want to repeat anything from my first birth. And I actually found one of the few doctors in the area of Seattle and the suburbs there that he did his own births. He was an OBGYN. He wasn't a family practice. And I specifically chose him because unless he was on vacation or sick, he did all of his own deliveries. And when I came in labor, the nurse called him, told him I was there. And she came back and she said, I have never had a doctor tell me this before. And I said, what? And she said, he said to me, give her whatever she wants. I don't care what it is. And if you can't do it because of hospital policy, call me and we'll figure out how to do it. He goes, just don't make her cry. Just don't make her cry. So cry at every single prenatal.
That'll help.
That helps.
But also if you have the option to choose a doctor that this is going to be my doctor, then you can talk to them beforehand and come to an agreement instead of being like, well, I don't know.
Exactly.
If your doctor may or may not be there, then he or she can't promise you anything.
Or choose a practice
maybe they won't be there.
With 2 or 3 providers rather than 7 or 8 providers. They do such big practices because they're doing 50, 100, 150 births a month. So choose a smaller practice that you can negotiate with each of the providers and see them each multiple times, not just if you have 7 or 8 providers, you'll see a provider max twice. That's
if you even meet them all.
Right.
Yeah.
Exactly. And so choosing those smaller practices that you have a better chance of negotiating with makes a big difference. The other thing is, not that all midwives are the same, because there are some that are very medical, but a midwife, you're going to have a better chance than you are with an OBGYN. A family practice doctor, you're going to have a better chance than an OBGYN.
Okay.
So, and then you have to look at your nurse. You know, if you got that nurse that in 20 years, she'd never seen a baby born any other way. Now, you can't control that, but you can say, I want another nurse. I don't want this nurse. There's only so much you can control. And that's why a lot of women do choose midwives out of the hospital.
Yeah.
Because on the back is the last position I'm going to choose for a mom.
Yeah, that's what I was going to mention, that, you know, we've been talking towards women who are going to have birth in the hospital. The majority of women do. But as you go through our channel and you learn different things about giving birth, if there's something that is really important to you, sometimes you need to choose an out-of-hospital birth, as long as it's safe for your pregnancy and everything like that, because you will usually have more flexibility. So that's something you can consider. Once I had an out-of-hospital birth, I never went back to the hospital, because having that control over my birth was important to me after I saw what a big difference it made in my birth experience. So we are actually going to talk about that in our next video, so be sure to watch that. And we're talking about the difference between a hospital birth, birth center, home birth, and the different options you have, the pros and cons of everything. So keep watching and you can learn all about that. And also don't forget that we have our free online birth class, How to Give Birth with Practically No Pain. We specialize in teaching women how to have low pain births. We're talking about a whole bunch of different topics on our YouTube channel, but that's our specialty. So be sure to check out that free class. There's a link in the description.